Hi, I am Dr. Vinder Singhal, pediatric urologist and hypospadias specialist.
I'm Dr. Ashwita Shanal, consultant pediatric urologist at Mitra Hospital.
Hypospadias is not a very common clinical condition, so people often do not talk about it. And even if somebody has hypospadias, they often do not share this information with anyone. For the last 18 years, at Hypospadias Foundation, we have treated thousands of children and adults with hypospadias. Through this video, we want to share our learnings and also provide you with facts which can help you seek the better treatment and achieve better health outcomes.
Surgery is required in hypospadias to correct the chordee, to create a urinary passage, and to bring the opening to the tip of the penis. The type of surgery depends on the severity of hypospadias and the degree of chordee. Our intent is to have a final cosmetic result where the penis is straight, the child or adult is able to pass single straight stream of urine with no pain. The final cosmetic result will be of a circumcised penis.
One of the main intents of hypospadias surgery is to give a functionally and cosmetically normal penis. When a child is growing up, if the child has a normal penis and the surgery has not been done, it can often lead to a lot of psychological impact. In some cases of minor hypospadias, where the opening is still at the glans and the penis is straight and the prepuce is complete, parents and we can jointly discuss and elect not to do a surgery.
Hypospadias surgeries are done under general anesthesia. In addition to a pediatric urologist, a pediatric anesthesiologist expert is required to manage and give anesthesia safely to children. Right from the dosage of medicines to maintaining airway should be done by a skilled pediatric anesthesiologist. At our center, we have 3 pediatric anesthesia experts who give anesthesia safely to children undergoing hypospadias surgery.
In addition to surgical anesthesia, we also like to give caudal analgesia, which is a small injection given in the tailbone. This makes sure that the child does not have pain even up to 12 hours after surgery. And it is very important. Children who have a good pain relief after surgery do not remember hospitalization as a painful episode, and that is very, very important. With modern anesthesia techniques and good painkillers available, most of the children are extremely comfortable after surgery, and we often do not get any calls or any emergencies for pain. It is very important that this protocol is followed through. The common surgical pain after surgery is managed with painkiller syrups, while 2 specific reasons of pain after hypospadias surgery require specific medications. One of these reasons is bladder spasms, and for that, we provide antispasmodic medications so that children can sleep comfortably at night.
Penile erections at night or early in the morning can also cause pain. Such pain is not very severe and oral painkillers are enough to manage the pain. The pain decreases significantly once dressing and catheter is removed. Penis will continue to be sensitive for the initial 2 to 3 weeks after surgery and later they subside. Adults may have severe pain due to painful erections, and in them we add a benzodiazepine which is given at night, which will decrease the intensity of pain due to erections. The risk of complications at our center, Hypospadias Foundation, is less than 5%. The common complications which can occur are fistula formation, diverticulum formation, meatal stenosis, and very rarely wound infection. Some of these complications may need an additional surgery.
Even if there is a minor complication which happens after hypospadias surgery, it's not the end of the world. In expert hands and at centers where dedicated hypospadias surgeries happen, second surgery can often set the things completely back to normal. Once a hypospadias surgery has been successful, most of the children will grow up to have normal fertility. That being said, if hypospadias is associated with undescended testes or a disorder of sex development, there are chances of infertility.
Uncorrected hypospadias or failed hypospadias repair can cause infertility due to various reasons. Some of the reasons are abnormal opening of the meatus, presence of diverticulum, stricture or presence of chordee. The altered or narrow opening can cause difficulty in ejaculation, hence causing infertility. Presence of chordee can make intercourse itself difficult or painful.
The severity of hypospadias and the success of surgical repair will define the final outcome of fertility. So it is very important for men who are suffering with infertility and hypospadias that they seek proper surgical treatment and enhance their chances of fertility.
Most of the cases of hypospadias are isolated with no genetic basis. However, now some studies show that the hypospadias is on the rise. This may be due to various genetic or environmental factors.
In some cases, hypospadias does run in families. We have seen some cases where the father had hypospadias and the child also had hypospadias. Studies have shown that this risk is almost 5%. Similarly, when one child had hypospadias, the risk of hypospadias in your next child would be about 5 to 6%. In fact, we have treated some children where both the twins had hypospadias.
Hypospadias, being a penis birth defect, is classified as an external birth defect and is diagnosed as soon as the baby is born. If the parents take an insurance policy after the baby is born, then the hypospadias repair surgery is not covered under insurance. This happens at least in India, while in USA or UK, hypospadias surgery is covered under insurance benefits.
The situation is very different in corporate or group mediclaim policies. Some of the progressive corporates or employers do provide policies to their employees where the external birth defects such as hypospadias are covered for their children.
As you seek treatment and information for your child with hypospadias, do write to us, visit us, and consult us for further information.
We will be very happy to help you and your family with great health outcomes.